The Thunder Bay District Health Unit reported a record high number of daily COVID-19 cases this weekend when it announced 33 positive test results on Sunday. However, health officials stressed that 28 of those cases were a result of surveillance testing at Southbridge Roseview Manor. The long-term care facility is currently experiencing an outbreak of the virus, affecting both residents and staff. This region now has nearly 100 active cases of the COVID-19 virus. To find out what these numbers mean, we've reached Dr. Janet DeMille. She is the medical officer of health for the Thunder Bay District. Dr. DeMille, good morning.
Good morning, Amy.
What is the latest on the continuing outbreak at Southbridge Roseview?
So there's really a significant number of residents and staff who have COVID. I think yesterday the numbers were 37 and 15, so that's a fairly significant number. There are a lot of measures that have been put in place, even strengthened further in the last few days to really stop any ongoing transmission in the facility. I think a lot has really been done to be able to do that, including bringing up more staff to be able to support Roseview at this time. So, obviously when you have staff who are in contact with COVID or who have COVID, they can't necessarily work at the facility, and so that was a problem. And there's now more staff, more infection prevention and control support, more reviewing of all the IPAC measures in the facility on a daily basis, and very heightened surveillance of all staff and all residents at this time.
And IPAC, is that in infection prevention?
Yes, infection prevention and control. So it's really, there was a lot of measures in place at Roseview, of course, as in any long-term care home prior to this happening. But certainly when there is an outbreak like this, you have to really be really strict and rigid and enhance those measures so that it doesn't continue to spread. So those were, we ourselves, the health unit, did inspections. Others were doing inspections, really reviewing and working with the home to be able to implement all of them.
So can you clarify more what the role of the health unit is in supporting long-term care homes? When you talk about these additional measures and things like extra staff, is the health unit providing those?
You know what? It's a really, there's a number of different partners that are at the table and meetings that are happening every day about this. So it's really a collaborative effort working with the home. Ontario Health North has provided some staffing support, especially around infection prevention and control. The hospital is there, the Ministry of Long-Term Care, and Southbridge, the corporation, is the one who's helping bring up most of the staff actually from other Southbridge homes, including staff who have experience with outbreaks, to be able to take some of the pressure off the Roseview staff. So there's a lot of individuals that have been coming together to discuss this and put these measures in place. What we do is we have a long-standing relationship with the home and with other long-term care homes. So we review what we call the line list, the people impacted by the outbreak and who are positive. We monitor the testing along with the home and monitor the number of people who still might need to have a test because, for example, that they've developed symptoms. We had public health inspectors go to the home to do an on-site inspection to try to identify any ongoing issues, and then reviewed their action plan around that to be able to really support the adequate infection prevention and control measures. But definitely, though, it's a strong partnership working with Roseview at this time.
I think that number that came out on Sunday of 33 new cases, that probably came as a shock to a lot of people. What was your reaction?
You know what? It was very discouraging. I think I knew that we were going to get these results back because the whole facility of Roseview, staff and residents, were tested on Thursday, and I know those were prioritized. So to see, the 28 that actually were directly related to Roseview, that's discouraging, and I mean it's worrisome because this is a long-term care home, and we know that that's a very vulnerable population, and so very uncomfortable because of that. I think overall, in terms of our numbers and stuff outside of Roseview, I had really hoped to see a bigger drop than we've seen recently in terms, the non-Roseview sort of cases, and not necessarily seeing that drop the way I would like to have seen it, unfortunately.
Why do you think that might be happening?
I just think we have sort of ongoing spread. A lot of it, we kind of know where people are getting it from. We can find the direct links between people of our active cases, but we just have had so many active cases and a couple of substantial outbreaks aside from Roseview that we're still seeing the ongoing spread. And we did have new measures put in place when we entered yellow. We continue to do a lot of work, really, on the public health side to aggressively contain this virus and to limit its spread. But it's still sort of happening among people who have COVID, so that's a problem.
And it seems we are seeing the cases of no known contacts more frequently.
I think it's around 10%. I do monitor that, and so it's not going up, sort of dramatically. So that would be an indicator of sort of broader community spread. We know our testing numbers are reasonable at this time, so we know people are getting testing. Still wanting to remind people, though, of the importance of staying home if they're sick and getting that test, so we can, not only help them, but monitor what's going on in the community. There's a concern with when you have active cases, of course, that there's spread that we haven't picked up, right? And that if that spread is happening, then that sort of leads to broader community spread, and that's concerning.
With previous outbreaks in the city, we've talked about those starting to level off at some point. With the outbreak at Roseview, where would you say we are in that outbreak? Are we nearing the end?
So it takes a number of weeks before you officially declare something over. I think we won't. I'm optimistic that we won't see another day where we're reporting 28 cases. I do know, though, we are retesting the whole facility today, and so we might still find individuals who have COVID that weren't picked up last Thursday. So I don't think it's over, but I think it's under control.
And you mentioned that we did make that move into the yellow category in the provincial system. Are you anticipating a move to orange this week?
So that is a decision that's made provincially by Cabinet and, of course, on Friday. And it's based on data that the ministry has, as well as what I provide in terms of the context or helping understand the story behind the numbers, if I could say it that way. Certainly when we look purely at our numbers, we are, I would say, in the orange level for sure. So that will need to be considered. And, of course, the numbers are going to be pulled, I think, at the ministry level. They do it today and they do it Thursday before presenting it to Cabinet. So and if there's any sort of dramatic decrease, it might influence that, but I'm not anticipating that. So I think that there will be serious consideration being given to moving into the orange level.
And how much will change if that happens?
So it does implement a few more restrictions on especially a number of businesses like restaurants and, event places, sports and recreation, for example, and retail. And so it just really strengthens them and puts more limits on them, including sort of, hours of operation, even the number of people that can be in any place at any time, for example. And it's really designed to kind of limit spread of the virus that may occur in those places. So it adds from where we were at with yellow. When we went into yellow, there was more limitations. And then if we go to orange, of course, there's even further ones. So it does have an impact on businesses and what they're able to do.
Back in November, the health unit made an announcement that inspectors were going to be visiting food and drink establishments in the city to conduct COVID-19 compliance assessments. Can you bring me up to speed on what's happened with that initiative?
Yes, so I think we have finished or are just about to finish all the inspections, so the dine-in premises, and that's in the Thunder Bay district as well, like the whole area. And I know that they're processing about the data and the numbers in terms of the compliance level. I think there's been a lot of changes in the regulations and the requirements for dine-in premises like this, and so I think we were doing a lot of work and education of the operators and education and identifying where they were gaps. And I think there wasn't really full compliance in many of the places, but some of these recommendations were fairly new, even sort of or not the regulations were fairly new. So really working with them about the next steps that they need to do to be in full compliance.
What are some of the areas where people might need to step things up?
You know what? So some of it is the old stuff, the older stuff. So of course the maintaining 2 meters between tables and patrons, the tables, for example, and just sort of strengthening that where we saw some of the weaknesses. Some of the new areas are around the Ministry of Labor has really wanted people as servers, for example, to be wearing better personal protective equipment. So the masks, the type of masks that they wear, and then eye protection as well, because when they're serving people, if people have removed their own face coverings when they're sitting at the table, then they potentially pose a risk to the server. So from an occupational health and safety perspective, the servers, the Ministry of Labor increased their requirements for that. So that's something new that many of the dine-in premises here hadn't yet fully implemented, so we were supporting them in that.
We're almost out of time, Dr. DeMille, but before I let you go, I do quickly want to ask you about the fact that we're hearing some confusion from people about isolation periods after they travel to other areas. From some sources, we're hearing 7 days. Other officials might say 14. What do you want people to know about that?
So I want people to know that the risk period after any exposure, including a travel-related one, goes up to 14 days. So their risk period is up to 14 days. What happens, and so our recommendations are based on that. The truth is that if people are going to develop COVID, most of them will develop between the first 7 and 10 days. So sometimes an employer's, for example, healthcare where workers return to work when they have full personal protective equipment, they have top-of-the-line stuff. If their employer allows it, we would say that's okay to do that. But for general community members, the risk period goes up to 14 days, and they need to be mindful of that.
Dr. DeMille, as always, thank you very much for your time this morning.
Thank you very much, Amy. Thank you very much, Amy.